So welcome to the second of our education webinars for IPALA. It's my great honor to introduce Professor Amy Gray, who is going to be discussing feedback in all its forms. Thank you, Amy.
Thank you, Richard, and welcome to the session. I'm going to take you on a little bit of a tour of feedback. And like I normally do, I'll be pausing at different points, maybe just to get you to think about what your response to these questions would be. You don't necessarily have to answer them, but just to actually think, you know, when I'm asked that question, what goes through my head? So I think the first thing I want to just float is when you think about feedback, what words come to mind? And I ask that question for a couple of reasons. One is because I think often when we put ourselves into the mode of receiving feedback, sometimes our response is negative. Oh gosh, you know, someone's going to give me feedback. It must have mean I've done something wrong. Sometimes when we think about feedback, we actually think about its absence and what could be better if we actually get more feedback, or if people could give feedback better to us. And then I think sometimes when we ask that question, it's actually us as the giver of feedback. And when we're giving positive feedback, I find that easy and rewarding. But when we have to think about corrective feedback or supporting learners in different ways, sometimes, you know, even starting what could be quite a simple correction or a simple piece of feedback can actually be quite difficult. So I think the first thing to say is feedback often brings up different emotions for different people. And when working with feedback, I think it's really important to sit in that space and acknowledge that. Because we're not simply dealing with words and thoughts, we're dealing with feelings. The second question I would float and get you to think about while you're listening is, what are the opportunities for feedback in your work? Quite often, again, speaking to trainees, I hear that opportunities for feedback can be quite limited, and it's often occurring at the end of a rotation when any opportunities, I guess, to respond to that feedback and work in a different way may have passed. And so the feedback sometimes comes too late or even not at all. If we think about what we're doing in feedback, ideally we're looking and observing people's behaviours and their actions and their thinking, and we're providing a timely response to that. So that implies actually the moments we should be giving feedback when we're working with people and working alongside them and having a chance to observe them. There are clearly some things we can observe and think about remotely, like how someone is writing notes or how organised they are appearing in terms of their time management or getting tasks done. But there's other tasks like taking a history, doing an examination, talking to families, talking to colleagues, presenting cases, that actually we have to be there and working with them to observe. Unfortunately, these opportunities are often when we're busiest and most tired and most under pressure, and feedback is also least likely to happen. So in my work, I certainly think about the ward round as one of the key times of my day when I'm working with my team, observing them and best placed to give feedback. The other opportunities might be in an outpatient clinic, but again, in outpatient clinic, the consultant and the junior staff are often separated from each other, or even the consultant and the medical students, and no one is, they're not working in tandem or alongside each other with a real opportunity to observe. So I would challenge us to think about when we genuinely have options for observation and what can actually increase those opportunities for observation. Certainly in my environment and in our context, we use mini CXs as one of the, I guess, the tools for work-based assessment, and I find them actually a good trigger for generating an opportunity for feedback. Trainees must complete them and require someone to observe them. And so by asking trainees, at the start of a week or during a week of work, if they have mini CXs they need to complete, and planning to do those during the week, we've almost made a contract to do feedback together, an agreement that this is going to happen, that we're going to watch and you're going to get feedback as a result. But outside of that, I think often feedback opportunities are missing. In our context, we thought about this and looked at this a number of years ago. This was an article written by one of our junior staff at the time. She's now a wonderful paediatric consultant. And we looked at really what our junior doctors thought about feedback that they received, but particularly focused on this concept of ward rounds, where we thought the greatest opportunity might lie. What we found in this study is probably not surprising, but I think worth considering. So clearly structural factors impact feedback, how busy the ward is, how many patients you have, how the team is set up, and whether you've actually got enough capacity and resource to take the time for feedback. I think also one of the key themes that came out of it was consultant influence. And this is where I think, particularly for the senior doctors listening, we've got to think of how we are modelling, encouraging and creating an environment for feedback. And what junior doctors told us quite strongly is when a consultant was interested in education, motivated to educate and created space for education, feedback happened. But there were many consultants who turned up and the sense was education was slowing them down. It was perhaps not their priority, and even opening the door to feedback was never going to be possible. I think the final thing that the trainees brought up was, I guess, the attitude of the trainee themselves to feedback. So trainees being willing and open to feedback, and other trainees being fearful of feedback. And in particular, trainees were fearful of being giving feedback, because their experience was it happened only when they did something wrong. And as long as it kept happening when they were feeling like they were being corrected or doing something wrong, then any kind of approach about feedback immediately generated negative feelings and put them on the back foot for receiving that feedback in a way that was going to be useful. So what can we do? When you think about feedback, what approaches do you know about for giving feedback, and what structures have you used or been told about? I've asked this question many times in many countries, and I can tell you one structure comes up every time, and that is the feedback sandwich, which is well known but probably should be thrown in the bin. So the feedback sandwich is the notion that we give some good feedback, tell them something good that they did, slip in the thing that we want to correct or the thing that we think they should improve, the bad thing that they did, and then end by making sure they don't go away feeling too bad and telling them something good again. It's nice and neat, and it's clearly been well accepted and publicised, because no matter what country I go to, if I ask them what structures do you know for feedback, this gets mentioned every time. And it gets mentioned every time like it's a gold standard, which it's not. When I asked my trainees about the feedback sandwich, about receiving feedback, they actually said, well, we know what you're doing. We know here comes feedback, and what they're going to do is tell us something good and tell us something bad and then tell us something good again. So I only listen to the bad thing in between. I ignore the good on either side because I really know the purpose of them is to soften the blow, and so I'm listening for the bad. So sometimes when we use a structure like this, we're actually setting, I guess, our trainees up for kind of predicting what's coming and, not necessarily actually hearing the good things we might genuinely want to say about them, but focusing only on the criticism. And I think that's even more true for high-performing trainees who are naturally critical of themselves, and so they will be naturally taking away anything that is perceived as a criticism from us. I think conversely, some trainees who really do need some improvement and need to take away some of that, the negative criticism or the corrective suggestions, are actually more likely to focus on the good on either side and then forget the bad in between. That if you end on something good, if you end on a high note, actually they can walk away thinking that wasn't so bad, and maybe we've actually lost, the intent of the feedback in the first place. So if you know the sandwich, if people around you are using the sandwich, encourage them to throw that sandwich in the bin. I do like this cartoon. It talks about the fact that the sandwich has been reinvented many times, and you can see in the middle the traditional sandwich, but there are lots of weak sandwiches out there where people load all the good side, load all the bread on either side and cover anything possibly negative or possibly corrective in good feelings so that people don't feel too hurt. But again, we're not getting to the point, which is improving people's performance and helping people work better. These are joke sandwiches, but clearly you can have a sandwich with no bread and significant, and others that are wrapped up and intertwined. I think the final thing is illustrated by this cartoon, which is no matter how well you construct that sandwich, no matter how well you give a bit of good information, insert corrective behaviour, use good language to tell people what they've done wrong, people may just not want to eat it. So let's throw the sandwich in the bin and think about some alternate models. This is probably the most well-known of the models that we know are more effective. And why they're more effective is that they put the learner in the centre of the feedback. So these are called Pendleton's rules or Pendleton's model of feedback. This is not rocket science, but in fact, it's actually striking to me in how many places this is not done yet. So Pendleton had he actually had 6 rules. I've simplified them to 5 and condensed 2 of them. The first rule is actually just checking that the learner wants feedback and is ready for it. I've already kind of reflected on how feedback can be so tied up in emotion that people may not want it or be ready for it. And so actually ensuring the learner readiness for feedback is a critical first step. Then to put the learner at the centre of the feedback, instead of us launching in with our thoughts, it's important to ask the learner what they did well. So the learner states what they did well, and more often than not, the learner will then decide that perhaps they didn't do anything well and they will start to criticise themselves. If this happens, you push them back to say, no, we're focusing on the good first. Can you tell me something you did well? After the learner states what was done well, you state whether you agree with that. Yep, I thought you did that well and why. Remember, just saying someone did something well is not necessarily feedback. It can be just praise. They maybe have told that many times without actually understanding why they've done a good job with that. And unless they know the why, they don't really know what tools they've got in their box that they should keep using. Once you've done the good, you can then focus on what needs to be improved. And again, begin with the learner. Ask the learner what could be improved. Once they've talked about what they can improve, that might be the end of it. You may just agree with what they've said that could be improved. And more often than not, when I use this model, in fact, that's where I land. They've identified their own issues and we can agree that that's what we're going to improve. And then I can work with them on how they can do that, potentially give them some strategies and a plan. And the plan might just be, these are some strategies I want you to use, or the plan might be, these are some strategies I want you to use. Next time we have this opportunity, I'm going to watch you doing that. So they're Pendleton's rules. They're quite simple to use, but anyone who's not in the mode of using them, I tend to find they fall back quite quickly into telling feedback rather than drawing it from the learner. So whenever you're trying a new structure, I recommend you practice until it becomes second nature and natural to you. This is another model for feedback, and this model actually came from the postgraduate course in clinical education that's run at the University of Melbourne. I don't think it has come from anywhere else. And this model is similar in many ways, as it's drawing on the learner first, but then maybe starting at a different point. So instead of saying, what did you do well, Aero focuses on feelings. So it starts with the effective question of how did that feel? So it's a small but important distinction, not what did you think you did well, but how did that feel? I actually find this really useful. Oh, not happening. Oh no, it's happened again. Let me try. Sorry, Laverne. I'm going to share again. All right, you should be seeing, can you see the Aero model? We'll try. Can't see any response. All right. So the effective, how did that feel? I find that a really useful starting point, because if the learner did well and feels good about how they did, then I know we're on the right track. We're going to have, we're going to share a common view of this this event that we've observed, that the feedback is probably going to be relatively straightforward. If I felt like it wasn't strong and the learner also didn't feel it was, felt bad about it, actually I feel the same. We're probably feeling quite similar about what we've just observed or performed, and actually the conversation is going to be pretty consistent. Where it's really useful, if the learner thinks they did a fabulous job and you maybe think there was a lot to improve. And so asking that question can be a really useful, I guess, starting point for thinking, are we aligned here? If they felt that was great and I thought, gosh, that was awful, then I know I'm going to have to move them from where they are in their feeling to where I think I am in my thinking during the course of this conversation. So I will often use this model much more often when I think the feedback might be difficult, or I have a challenging learner and I kind of want to see where they're thinking and feeling before I navigate that path. So that's the effective. How did that feel? Once you've got the affective, you can then ask about the effective, which is very similar again to Pendleton. Can you tell me what worked well? Can you tell me what you did that you thought was most effective? What went well? You may add to that at that stage, or you may just let them talk through it. You don't necessarily have to interject as the giver of feedback in this scenario. And then after that, you ask them to reflect. So what would you do differently? This is the question around improvement. What would you improve, or what would you change? And then finally, the objective is really where you get to add your thoughts, see what they think, and make a plan. So in a bit of contrast to Pendleton, which is much more back and forwards between the learner and the giver of feedback, this is much about the learner from the start for the first 3 parts, and then at the end you're saying, hey, I'd like to give my thoughts about it. So that might be where you agree with a lot of things they've said and come up with some ideas about how they can move forward. Or it might be, if there is a disconnect between the learner and their thoughts about their performance and your thoughts about the performance, the objective is your chance to, I guess, steer them on the right path. And so that might be, would you mind if I gave you my thoughts? Actually, I've got some concerns about what I've just seen, or actually I do think there's a couple of areas we really need to work on or focus on so that you can improve in the future. So even if the conversation's been relatively good up until that point, you may have to step in the objective part to actually steer the learner in the right direction. So 2 different models for feedback, similar in some ways, but different in the kinds of conversations they may generate. Is one better? Now, hopefully that's changed. Hopefully the screen has shifted. 2 different models, 2 potentially different conversations, but drawing a lot on similar principles. And what I would say is there's not one model of feedback that works for everyone every time. The principles help. And actually the main reason for using any model in the first place is so that you've got a structure to hang your conversation on, to get you comfortable with how you're going to drive those conversations. And then in the future, you can kind of play with those models and add your personal touch or do what works for you. And the principles for feedback are pretty much the same, no matter which model we're talking about. First of all, it should be a conversation. By that we mean a dialogue, back and forwards, not a one-way conversation of a teacher or a facilitator telling a learner what they think. And when you think back to that sandwich model, that is exactly what you're getting with that model. It's based on rapport and permission. So understanding that feedback can be hard and people can be sensitive around it, actually asking permission for feedback and establishing that it's kind of part of what we are going to do together as part of our work together. is a really important part of making feedback work. And I'll come to that in a minute. Sometimes in the education literature, people talk about an educational alliance that a teacher and a learner establish to basically agree that part of us working together is that I want to look at your performance, help improve your performance. Part of that will mean giving feedback and talking about what you're doing well, but also talking about what I think you can improve. That can be set up in, whether you're working with trainees or students over a long period of time, over months of rotation. It can be set up if you're working with trainees or students in a week kind of setup when you're on ward service or managing the wards. It can even be set up in the context of a day. More often than not, in many health services, teams are now being thrown together in a day, and they need to work together on that day. And quite often I think people are like, well, it's too hard to do feedback, it's too hard to do teaching and learning. But in fact, if you can think of ways to set up that educational alliance quite quickly and use language around, I'm really keen for us to work together, but also to watch you and see if I can give you some feedback today, then you're already setting up a culture or an environment where that feedback is expected and perhaps more likely to be received. The models have a few other things in common. They are targeted. We're talking about actions and not the person. Again, this can be tricky. Sometimes, some of the behaviours we're talking about are really close to a person's character or to personality traits. I've had some classic examples of this, and I've had to really try to think about how I am focusing on the person's behaviour. One example was a trainee who, whenever she presented a case to me, she just seemed really bored. She seemed like it was a hassle. The parents were a hassle. She didn't know why she was even there presenting or seeing them. She was like, oh, so this patient. And there was a real sense of the work being a hassle rather than something that was her job and something she enjoyed doing. Now, giving that feedback is really tricky. It does feel like you're commenting on personality and how they're talking and their mannerisms. And so I had to work out the language that I was going to use to say, look, when you present cases to me, I hear exasperation. Sometimes I hear you sigh, and I sometimes see, facial expressions that actually make me think that you're not interested in the case, or perhaps, the case is a bit of a hassle. This may not be true, but actually it's impacting on, the way we're having these clinical conversations in this way. And I don't know that that's what you intend. And it was really difficult feedback. But the trainee involved took it on and came back to me the next day and said, I'm so glad you told me that, because I've now talked to my family members and they all say I do exactly the same thing at home. And I've worked out I need to actually work on some of these things that make people think things that perhaps I'm not actually thinking. So feedback done well can be successful. Feedback should be timely. So again, often if you are going to actually comment on something you observe, don't leave it too long. Our jobs often take us away from being able to do that, but try to think about how you can come back quickly and give someone that feedback. And as we've seen in the models, it should be learner driven and responsive to what they're talking about. In practice, this is what I said before, models are there to use to help find your feet. And as you get more comfortable, we often make feedback our own and find our own approach to it. But actually more important than the models themselves is the culture we set around feedback, and ensuring that we have a culture where feedback occurs and is able to happen. And when I'm talking about culture, I think this is something I strive for and don't always achieve. So can we give feedback in limited time? Can we, in our busy jobs, when we're seeing someone in the midst of multiple other patients, can we actually give feedback in limited time? I'm a strong believer in the fact that brief focused feedback is better than none. And if we actually do it more often, if it's part of what people expect from me, then it doesn't become such a high stakes thing every time it's given. If someone's only going to get feedback once every 6 months or once every 3 months, every moment of feedback can actually be incredibly stressful. But if every week I'm working on the ward with a team, I'm like, hey, I'm going to give you some feedback, and it becomes part of the work, then actually the stress around the feedback comes down, the stakes around the feedback comes down, and people will start to respond to it better. And I'm going to be completely honest and say this is hard to achieve and I don't always succeed. But if you can do it, then ultimately you're making it part of the culture. I've been trying to work on this with my ward team this week, and you can do incredibly simple things like watching a resident examine. And I watched a resident to do a respiratory exam on a child with significant pneumonia today, and she listened and then she told me what she found. I said, what about the percussion? And she's like, gosh, I always forget to percuss. Incredibly simple, timely feedback that we can prompt and change how people are behaving. People have heard me talk about my ward round feedback, my ward round framework before. I'm just putting it up to the reminder. Is feedback in 5 minutes possible? It is. I'm not going to try to play the video that's there, but if you look for stick on ward rounds and go to the tool and click on the feedback button down here that you can see on the screen, there is a video there of how 5 minutes of feedback on a ward round might look. Basically using a Pendleton's type model and asking permission before you go into the room to say, hey, I'm about to watch you doing this. Is it okay if I give you feedback afterwards? If I'm going to give you feedback afterwards, what do you want me to focus on? And then afterwards, really focusing on what they wanted and getting them to say what they did well. You just agree to add and then to correct. It's possible. It's possible, but like I said, I think we all have to keep challenging ourselves if this is going to happen. The final thing I will say about feedback in kind of our busy job is feedback can be really hard. And even this notion of feedback bringing on feelings and emotional responses means that we often avoid it. And again, I think I touched on this last time I talked at one of these seminars, but if feedback is hard, then start with reflection as a less threatening step. Instead of talking about feedback, talk about, hey, can we just reflect on what just happened? After a clinical counter, ask them how it felt and how they think that went. And don't talk about it being feedback, but just saying, I think it's really important sometimes when we're watching each other on the ward that we stop for a moment and reflect on how we went and what happened. And in order for that to feel more natural for junior staff, it's important that we model that as senior staff. So again, on my wards this week, we've had an incredibly difficult and challenging diagnosis. And so I had to go and talk to the family about that diagnosis, which involved a lot of complicated notions, but also a lot of bad news. And at the end of that conversation, instead of just saying that's done and let's walk away, I take my junior staff outside and I ask them how do they think that went. They're often incredibly complimentary and that's lovely, but I also ask them to tell me things that I can improve. And so I think if we can reflect on our own behaviours, our trainees are more likely to reflect on theirs, or at least allow us to reflect on theirs. So now we'll talk about feedback in all forms. And so one of the forms of feedback that I don't think gets talked enough about is feedback up. Again, a question for you to think through while I'm talking is, how often do senior staff, get feedback from their junior staff? How many times, if you're a senior person online, have you been given honest feedback about how you are working and how you are managing your team, or how you are perceived as a clinician? This question came up for us in our team and in our department. And it came up enough that we had to start to look at it. It came up first when we talked about how we could improve feedback for junior staff. And everyone said, well, this is really important, but what about our feedback? We were always talking about the feedback that the junior staff get, but where is our feedback? And it came up again from a junior staff perspective when, on multiple occasions, when they were like, what is the mechanism we can use to give feedback to our senior staff? I think until that point, we'd perhaps naively assumed that we were nice enough paediatricians who were approachable and generally got along with most people, and so that if someone really wanted to give us feedback, they would tell us. I think many of us, certainly myself, as I'm wrapping up time with a team, I'll often sit them down at regular intervals and give them some feedback, but also ask for feedback on myself. A lot of that feedback has been, again, positive and lovely to hear, and often quite specific, talking about why they like the way I work or why they like what I do. Occasionally, a trainee's been brave enough to say something different that I should change or something they would like me to do more of. And when that happens, I'm really appreciative. So there's enough of a question around, do we need a better way to get feedback from junior staff to senior staff, that we actually decided to do a research project on it. And this paper is being submitted for publication, but I can talk to you through the ideas. We started with the question of, do people want this? Do people actually want feedback at a senior level, and do junior doctors or nurses actually want to give it to their senior doctors or nurses? And we looked at both nurses and doctors. We then asked if it was happening, and for the vast majority of people, this wasn't happening in any systematic way. But when we asked people if they wanted it to happen, more than 90% of both senior doctors and junior doctors wanted a mechanism to give feedback up. The only problem was, when we looked at the data, our senior staff wanted it for validation. They wanted to know that they were doing okay. They wanted evidence that that the juniors thought they were doing a good job. The junior doctors wanted a safe place to complain about senior doctors and to talk about the difficulties that they were having with certain senior staff, and to have a mechanism for actually pointing out bad behaviour. So already we have this tension between everyone wanting feedback up to occur, but the intent of that feedback is completely different between our juniors and our seniors. Further to that, when we asked them how it should be given, the junior doctors, again, unsurprisingly, all said we want it anonymously in writing, and the senior doctors, unsurprisingly, wanted it verbally from the source, knowing that they could trust who it was coming from and who was saying what. We can't reconcile those last two things. We can't reconcile the different intent and the different ways to do it. We have to keep the junior doctors safe. So if we're going to do it, it has to be given as written feedback. And so we're most of the way through a project now, which is implementing a feedback up system using anonymous written information that is then digested, summarised and triaged by our head of department to give it back to our senior staff members. And I think it's been an incredibly important learning opportunity for us in that, while we all kind of thought we were lovely and approachable paediatricians, what's incredibly apparent is there's lots the juniors want to tell us about ourselves that they're not telling us to our face. And that information is not always super critical, but it's actually super valuable. And so we're currently trying to process that and understand how you sustain a system like that can actually, feed back things up the chain that are really important for senior doctors to know. So I think it's really important when we're talking about feedback that we're not just talking about top down. I think, we also have to think about bottom up. The final kind of concept I want to touch on with feedback is what we can learn from athletes. And I'm not sure if anyone else has touched on this, but there's emerging evidence from medical education that actually people that come into medicine with an athletic background or having played a competitive sport at an incredibly high level actually relatively outperform others as a general cohort. And some of this is thought to relate to how they are conditioned or trained to take feedback in their sporting endeavours. We had a competitive rower in our team as a trainee, and she, I guess, was surprised by the fact that people kind of tiptoed around feedback, and yet part of her weekly routine to be better at her sport was to get feedback, to respond to that feedback and improve. And so there have been a number of studies now looking at this concept of feedback and the learning culture, and what we can learn from musicians who are, again, highly trained professionals who have a culture of getting feedback for improvement, and highly trained athletes who have the same. And in effect, a lot of that is that is showing is that the culture of feedback is the critical part. And in medicine, the culture of feedback is often one of defensiveness and difficulty, whereas in both of those fields, it's one about it's expected and accepted and actually sought. Similarly, this is what I was speaking to before. This is a recent systematic review from 2023 actually showing that the performance of athletes who enter medicine is higher. And a lot of that is around their attitudes to feedback, their approach to goal setting, getting information about their performance and responding to that information about their performance, just as they would playing a sport. So if we could all think of medicine as a sport, in some ways, we'd be setting everyone up for more success. And again, a 2002 article talking about the fact on why, you know, athletes excel. And it again talks to that notion of goal setting, feedback on performance, being able to respond to that, being resilient to that, and expecting that as part of the culture. So can we learn from athletes? I think we can learn from athletes. I think we can set up cultures that feel more like this than they do the hierarchy that comes with medicine. So I'm going to summarise, and I know we don't have a huge group today, but I'm going to summarise and then leave it open to comments and questions online. So feedback, it's not going away, and I think it's a concept that will always challenge us in medicine. There's lots of different aspects to feedback, but there are models there to help you get started. I think when you're using models, it's great to find your feet, but again, find your own approach and be adaptable. I would encourage everyone to think that feedback is possible in limited time, because if it's not, we're missing so many opportunities for feedback in our daily work. And if feedback is too hard a step, then go to reflection. Encourage people to reflect. And in some ways, that is a safer conversation. And the final thing I would say is don't forget your seniors. So everyone needs feedback to improve. And if we are really talking about a learning culture, we should be talking about senior staff also. I'm going to stop there. I'm apologising for my slides not advancing at the start. So if there's anything you need to see from the start that you didn't see, again, you can let me know. But I might stop and see if there are any questions or reflections.
Thank you, Amy. The panelists can be reassured I'll stop the recording at this point.
Thank you.
While they're considering, can I please ask the first question?
Yeah.
And yes, okay, I'll get this. Sorry. It's
good that you stopped the recording, because now
the surgeon, right? He wrote a book about coaching and surgical coaches, and
yeah.
it's maybe kind of relates to what you were talking about in the last few slides. But I've not heard of anyone do something similar in medicine or pediatrics. So, do you have any thoughts on that idea?
The idea of coaches?
Yeah.
So, I mean, I think we certainly, I mean, I certainly use coaching as a tool for, like, so when people talk about coaching, I guess, you know, in medicine now and in medical education, there's the concept of using coaching to improve people's performance and encourage staff development. That notion of coaching is much more around, you know, I guess having someone identify their own goals, identify the, you know, people talk about the GROW model of coaching. I know it's one promoted by our college. And that's kind of, you know, what's your goal? Where are you at? What information are you getting to tell you that you're at there? What are the options that you've considered to move forward and to grow? And then, you know, where to now? What's the plan? So that, I mean, that is a model of coaching in terms of structuring the conversation in a different way. And sometimes what I do in, you know, when I'm talking about feedback is to have people have a feedback conversation and a coaching conversation, and to think about how it's different and when you might use one over the other. There is some notion around using coaches in medical education, and I've actually toyed with the notion here in our hospital. So when we were coming out of the pandemic and people were talking about our workforce being relatively depleted and, relatively junior staff in the ward, I was like, well, instead of just putting more educators into the system and talking about more tutorials or more sessions to bring people up to speed, why wouldn't we use coaches, putting coaches out there on the wards that they can watch and coach and give feedback and actually kind of create this learning culture. There are some papers around there looking at coaches in a medical workplace and how they might actually work to improve performance. I guess, we didn't succeed in doing that. People were not quite ready for something like that in their own context. I guess in an ideal session, the ideal coach is the people you're working with. I think it's really hard, and particularly in budget-constrained hospitals, you're unlikely to get someone extra to come in and coach you and give you advice and thoughts. So coaching has a role, and I'm not sure if I've answered your question, Richard, but I think there's different ways for us to think about. And I think if we can actually have more of a coaching kind of sporting mindset to our development of our teams, then I actually think it might make our life easier in terms of starting some of these feedback conversations.
Thanks, Amy. I really like that, those ideas. And I think it just, when you phrase it as a coach, I think that there's a slight mind shift, and the perception is that there's less criticism, that any feedback is there to develop you further, which is, that's the idea behind feedback anyway, but the perception is maybe slightly different.
Oh, completely. Yeah, feedback is seen as very much someone imposing on others, whereas a coach, I think, is I'm here to get you to the best you can be. So yeah, I think we should explore notions of coaching, or at least framing things as coaching, much more. I think there's years of literature and feedback, and actually it hasn't shifted the dial in many contexts. So I think we need to think about it in other ways.
Yeah, it's very interesting. Thanks, Amy. And I don't know if you've seen, there's a comment from Laverne. I can read it out. It says, I think giving feedback to senior staff is very important. However, some trainees are concerned that they can be traced despite being anonymous. What's your suggestion?
Yeah, so absolutely, Laverne. It's the main reason juniors don't want to give feedback. I guess that's why we're piloting the approach we're using. We're using very short kind of survey tools where they basically say, who did you work with? What's one thing they did well? What's one thing they should improve? So it should take a minute to complete. And by doing that, we are trying to get enough responses so that by the time the feedback is given to the senior person, the chance of there only being one or two people who could have possibly said that, so that they're exposed just by virtue of low numbers, is low. So we're able to do that, over about 6 months on our teams. We have enough people come through and work with different people on our teams that, it would be hard to trace it back to one individual. But it is one of the main reasons we're actually piloting this as a research project, because the idea that we know how to do this and could do it well and sustain it and make it feasible is that's not certain yet, and we don't know that we've got the right approach yet. I think we're also using that filter of our head of department being the receiver of all that information and then deciding how they summarise it and give it back to the people involved. That's allowing at least some moderation of comments where we might think, gosh, that's a bit left of centre, or it doesn't quite make sense that comment has been made about that person at this time. I think you're absolutely right. Juniors avoid it for that very reason. But I can tell you from the data that we're getting from our department, it's possible, and they will tell you things about you that you can improve if they feel like there is enough safety in numbers. I can't see there any other questions. I can't see actually Laverne's question, so if there are any others, just let me know.
Once that's published, you should let us know. We can put it on the website. It's going to be something of interest to a lot of departments. Thanks.
Yeah, I'll let you know. Any other questions or thoughts? Feedback has been around so long. I sometimes feel like I'm, telling people things they must already know. But it's been striking to me the number of times I've talked about feedback, and we're all back at the sandwich model and doing things quite simply. So I hope that the content that I've covered today is useful. I hope it's given you a few different things to try and to think about.
I don't think there are any other questions, at least in the chat, and nobody's unmuted themselves. So Amy,
That's
thank you
okay.
again so much. It's always wonderful to hear your words of wisdom on these topics, and we
You
really
too,
appreciate
Connie.
it.
All right. Lovely to see everyone tonight.
I mean it. Yeah, thank you again. And a quick plug: we've got your final session for the year in a couple of months' time. So I'd encourage everyone to sign up and spread the word amongst your colleagues. Laverne's put in the chat. Thanks so much, Amy. And a
Pleasure,
round of
Laverne.
applause.
Lovely to see you again.
All right. Thank you very much, Amy. Take care.
See you.
Bye.